Today we're going to talk about a medication you've probably heard of, isotretinoin. It's this source of incredible hope for some, and honestly, serious concern for others. It's famous for being unbelievably powerful against severe acne, but that power definitely comes with a price. So let's get into it.
This quote really just says it all, doesn't it? For people who have tried literally everything else and nothing has worked, isotretinoin isn't just another thing to try. It's often the last resort, the one thing that might finally offer a life-changing solution to a condition that can be physically and emotionally just devastating.
Okay, so first things first, let's break down what isotretinoin actually is and, just as importantly, who it's for. You have to understand this part to really get why it holds such powerful promise.
At its heart, isotretinoin is what's called an oral retinoid. Basically, it's a synthetic form of vitamin A. But here's the key difference. Unlike a cream you put on your face, this is a systemic medication. You take it as a pill, and it works throughout your entire body. And that's a huge reason why it's both so effective and has so many side effects.
And this is super important. This drug is not for a few pimples. It is specifically reserved for the most severe kinds of acne. We're talking about those deep, painful nodules and cysts that just don't respond to anything else. It's also an option when acne is starting to leave permanent scars or when it's causing such deep psychological distress that it's impacting every single part of a person's life.
So how in the world does it work so well? Well, its incredible success rate comes from its unique ability to attack all four of the root causes of acne, all at the same time. No other single medication can do that.
Okay, check this out. First, and this is the big one, it physically shrinks your oil glands. Second, it helps normalize the way your skin cells shed so they stop clogging up your pores. Third, by getting rid of all that oil, it basically starves the bacteria that cause acne. And finally, it has a direct anti-inflammatory effect, calming all that angry redness and swelling. It is a total shutdown of the whole acne-making process.
And get a load of this number, 90%. That's the drug's superpower right there. It can slash your skin's oil production by up to 90%. By cutting off acne's fuel supply that dramatically, it just fundamentally changes the entire environment of your skin.
Now, you don't just get a prescription for this and walk away. And that's crucial to understand. Taking isotretinoin is a highly structured, very closely monitored medical journey. It requires a serious commitment.
So a typical course of treatment lasts somewhere between 4 and 6 months. Your dose is carefully figured out based on your body weights because the goal is to reach a very specific total amount over time. Hitting that target number is key to reducing the chance of a relapse. And all of this means mandatory monthly visits to your dermatologist and regular blood tests to keep an eye on things like your liver and your cholesterol levels.
Here in the United States, all of this monitoring is formalized under an incredibly strict program called iPledge. It was put in place by the FDA for one reason, to manage the drug's most serious risk, which we're about to get to.
And this system is especially strict for female patients who could become pregnant. We're talking 2 negative pregnancy tests before you can even start, a commitment to using 2 different forms of birth control at the same time, and mandatory pregnancy tests every single month before you can get your next prescription. It is a lockstep process for everyone involved, the doctor, the pharmacist, and you.
Okay, so the reason for all this strict control becomes crystal clear when we look at the side effects. With this kind of power comes a whole profile of significant risks that every single patient absolutely has to understand before they start.
First, let's talk about the common side effects, the ones that almost everyone gets. Think extreme dryness everywhere. We're talking severely chapped lips, dry skin all over, a dry nose, dry eyes. Actually, that severe lip dryness is often seen by doctors as a good sign. It means the medication is working at the right dose.
And here it is. This is the single most critical risk of isotretinoin. It's the entire reason the iPledge program exists. The drug is a potent teratogen. That means if it's taken during pregnancy, it carries an extremely high risk of causing severe, life-threatening birth defects. This is a non-negotiable, absolute warning.
Beyond that, there are other serious, though less common risks to know about. These can include potential psychiatric effects like depression or mood changes, increased pressure on the brain, and stress on your liver and lipid levels, which, again, is why those blood tests are so important. Any new or unusual symptom must be reported to your doctor right away.
So when you put all of this together, it's pretty clear why our source material describes isotretinoin as a true double-edged sword. It offers this incredible solution, but it comes at a significant cost.
This slide really just lays out that central conflict perfectly. On one side, you have the benefit, the chance to finally clear severe, scarring acne and the massive psychological relief that comes with it. But on the other side, you have the cost, serious side effects, constant medical monitoring, and the need for absolute disciplined compliance from the patient. So really, this is not a journey you can take alone. The success and the safety of this treatment depend completely on an open, honest partnership between a well-informed patient and their dermatologist. Communication is absolutely everything.
Ultimately, it really all comes down to this one question. Isotretinoin presents a powerful choice, where a life-changing solution is balanced against life-altering risks. For the right patient, under the right supervision, it is still the single most effective weapon we have against severe acne. The key is just making that decision with a full, complete understanding of both sides of that sword.